Здравствуйте. Извините, пожалуйста, но я говорю не очень хорошо по-русски и немного понимаю. Так что я думаю, это видео будет на английском. So today I wanted to speak a bit about the different levels that we encounter in neoclassical acupuncture, the different levels you can treat the patient at. The most superficial level, the level right on top, is the meridian level. So we have here a patient, we already know her problem. She's a runner, she does a lot of CrossFit, a lot of sports, and she has problems in the whole lateral side of her knee. She has problems in the stomach channel, stomach channel, gallbladder channel, bladder channel. It's extreme pain on this entire side. So just quickly I wanted to show you with other systems, for example with TAN, or the balance method, you need to put a lot of needles in trying to open 3 meridians, an opening stomach, opening gallbladder, opening bladder. And with this system, I teach a very simple method. With 1 needle you can open up everything. So here we have 3, there's many different ways to do it, but I'll just do a very simple way. With 1 point, we can open up stomach, gallbladder, and bladder. How does the leg feel now?
Good.
Oh, okay. If the pain was in 10 before, and what is the pain level now?
Like 3.
In 3? Okay. So it's gone, the pain has been reduced by 70%. I'm just going to move the needle a little bit. How about now?
Maybe 1 here.
Okay, so the pain's been reduced by 90% in about 20 seconds. If we leave it for a couple minutes, it should go to 0. There's other levels too. There's a deeper level in which you can treat everything, all of the symptoms without knowing what the symptoms are. So we also have a patient here today who they tell me has several problems, and we're going to treat them without asking the patient what their problem is. And we'll be treating that on the deepest level, which is the elemental level. So now we have with us our patient with multiple problems. I just wanted, just before doing the therapy, I want to explain a little bit about what we're going to do. In the treatment prior, when we were treating our patients, the lateral side of her body, we needed to know what her symptoms were. So let's just say, here's some symptoms. These are some dominoes. And we had pain in leg. And maybe it was caused by poor circulation. And so we treated on the level of meridians. So by opening the meridians, we help the circulation, the energy, the blood, and opening the circulation, we got rid of the pain in the leg. So it seems like, on some level, maybe it's deep. But in this system, this is the most superficial level. So I want to do a treatment on a deeper level, which is on a level of what we call the elements. When I say what we call the elements are a very typical concept. It's a term used a lot in acupuncture. The use we have of the word elements is very different. I would say to an extreme, different from what they use in 5-element acupuncture. What we're going to do in this case is we're not going to take into consideration the symptoms. We've asked the patient, we haven't asked them what the symptoms are, but we've asked how many problems there are, and there are 4. The first problem she has is 9 out of 10 on a pain scale. The second problem is 7 out of 10. The third is 7 out of 10. And the fourth is 8 out of 10. So we have a good case here with 4 different problems, and they're all relatively high on the pain scale. So we're not going to ask the patient what these problems are. We're simply going to go, let's forget about the patient prior, and we're going to go to the first domino. There's many more dominoes than this. But we're going to treat on the elemental level. And when we get rid of this domino, it should cause a chain reaction which is going to get rid of all the dominoes. So maybe here problem number 1 is here. Problem number 2 is here. Problem number 3 is here. Problem number 4 is here. These are all, we've asked, and they're all problems on the physical level. You also have problems on the emotional level, which come before this. So when we throw this first domino, it should take care of problems emotional, physical. We don't distinguish between those 2 levels. It's always much more fun when they're physical problems because it's much easier for the patient to objectively say how much better they feel with the treatment. So what we're going to do is we know there's 4 problems, we don't know what they are, but we're going to throw the first domino and see if that will cause a chain reaction which gets rid of everything. You may just quickly, you notice that there's pain in the legs. And part of these dominoes are included meridians that might be closed. So when I say closed, it means meridians which have pain along them. So when we treat this level, it should open up all of the meridians and get rid of maybe 70 to 80% of her physical symptoms. So let's do a diagnostic. This time it's going to be in the abdomen. Okay. ¿Molesta aquí? ¿Seguro? ¿Floja? ¿Floja? Okay. ¿Aquí? No. ¿Acá?
Sí.
Okay. ¿Y aquí?
No.
Okay. So her problem, if we gave a diagnosis, the diagnosis would be predominance of water due to a deficiency in the yin form of fire. Probably don't understand that, but it's the terminology we use for the diagnosis. So what we're going to do is treat this elemental imbalance. ¿Cómo está aquí ahora? Okay. How about here? Aquí? Aquí? Okay. And what I'm putting here we call the sweeper. The sweeper is just a point, we've already changed the element, it's already been changed. So once that happens, it should open up the entire body. And when all of the energy opens up, there might be errant energy, or energy which can go to the head and cause problems. So we have to pull that energy out. And I'm using 2 points we call the sweeper. So I just want to make sure all of the dominoes have fallen. So one way is have all the meridians opened up. ¿Está bien? Okay. And quiero checar a ver si tiene alguna otra cosa aquí.
Ahí.
¿Y aquí? ¿Sí? ¿Cuál duele más?
Es.
Este. So there's pain in one of, we call this the ovary reflex. It's an obstacle. So in this case we have what we call what is an obstacle? When we get rid of this domino, I want to make sure it's all of the dominoes have fallen. So I want to make sure there's no dominoes which resist falling here. So I need to treat this. Okay, how about here? Okay, so I think our treatment is done. I need to do one more thing to pull energy out. And I believe our treatment is done. So let me just make sure. Fine. Okay, so now we're going to ask the patient what these 4 problems were. Okay, so now we've asked the patient to name the problems. Now the treatment's done. But we've asked the patient, her first problem was 9 out of 10. It's knee pain. It hurts when she tries to bend down or go upstairs. Her second problem is 7 out of 10. It's pain in the elbows. Her third problem is stomach pain, problems with digestion, 7 out of 10. Her fourth problem is pain in the upper back, and it's 8 out of 10. So we're going to ask the patient now, let's see the knees. We need to take her off the table to try. Let's have the patient stand up. This was a quick treatment. I think it was about 3 minutes. Okay. And 4 needles. Okay, si puedes ponerte a pie, a caminar. So we're going to try these problems one by one to see how she feels. ¿Podrías probar las rodillas? A ver, intenta agachar.
Muy.
So the knee pain, ahora de 0 a 10, ¿en cuánto está?
No, ya no tengo dolor.
Okay, so the knee pain was reduced to 0 out of 10, it was reduced to 100%. ¿Puedes probar los codos?
No, ya no me duele.
De 0 a 10. So the elbow pain and the knee pain was reduced to 0 out of 10. The elbow pain to 0 out of 10. El estómago, ¿cómo lo puedes probar?
0.
Okay. The stomach pain was reduced 100%. And pain in the upper back, was it, which side was it?
Nada.
Nada?
0.
Entonces, so the pain in the upper back was reduced to 0 out of 10. This case was a little more complex because we had an element and we also had what we call obstacles that we had to get rid of. But this is just a quick treatment as an example. We didn't know what symptoms they had, but you don't need to know what symptoms they have when you're treating from the deepest level.